by all of you being here. You shouldn't underestimate your power, and I'll just tell you some stories and why it's so important that physicians be there. So I'm a lifelong activist. I'm a professor of medicine and infectious diseases at UNC, and did NIH research for many decades. But I've been a lifelong activist. Starting in medical school, when I was at Harvard, my classmates and I joined with other like-minded faculty, mainly on the undergraduate campus, to stop the research of a psychiatry professor, Stanley Walser, who was doing unethical research. As a resident, I went out on strike with my fellow internal medicine residents over the way the patients were being treated at Montefiore Hospital in the Bronx. And in the early days of the AIDS epidemic, the community activists would call me up and say, we need you to come to the legislature and testify because Lieutenant Governor Gardner wants to test all healthcare workers, all food service workers, all teachers for HIV. And so we did that and they stopped it. It died in committee. So, and then moved forward into 2006, a retired professor of medicine and nephrology at UNC, Arthur Finn, called me up and he said, could you do me a favor and write a letter to the North Carolina Medical Board saying that you think doctors shouldn't and nurses shouldn't be involved with executions? Well, I didn't have much thoughts on that subject, but I said, oh, it's Arthur, I'll write a letter. And I wrote a letter, and then I got a call about 2 weeks later saying, would I come testify? So then, of course, I had to learn about executions. And something to say that I did testify. The board then made a ruling that no healthcare worker, and I convinced them that they shouldn't even be in the execution chamber at all. And that was the last execution in North Carolina. That was one letter. It took one letter, which took me 5 minutes to write, and then a 2-hour trip back and forth to Raleigh to testify. That's all it took. So it shows you the power of being a physician. When the ACA was being under consideration, we held a rally in front of the hospital, and we got people from physicians, private practitioners, patients, a VA patient who was a terrific, and we had all the press there, etc. And it got great publicity, and of course the ACA passed. And then in 2010, when the Republicans took over, and then more importantly 2012, when Governor McCrory was elected, the legislature then threatened to pass a bill not expanding Medicaid, as you know. And what happened is that we held a press conference at the legislative building. I wrote an op-ed, and I'm going to come back to some of these things about the 10 points to overcome all these problems we're having. So we did that, and of course the legislature didn't listen to us. And then in 2013, I was arrested with Reverend Barber and 900 other people. So, and I'm alive. Nothing bad happened. Despite all those protests, I survived. So one of the things I want to talk to you a little bit about is I'm the keynote address. No slides today, but I'm going to go on a little bit. Is that you've got to know your history, okay? So many people despaired after the election, and it was terrible, I agree. But, you know, as Martin Luther King said, the arc of the universe bends towards justice. And I'm going to get teary-eyed there. And I really do believe that. And, you know, President Obama said that it goes in fits and starts, and I believe that too. And it's important to remember of how far we've come. Remember, 60 years ago, African Americans were in the back of the bus. Women were in the kitchen, and gays and lesbians were in the closet, okay? We've come a long way since then, and we're going to continue to go on. And we scare the shit out of old white men.
Yes!
So that's why this is going on. This is their dying gasp.
Right.
So I want you to say, why was the ACA important? And I want you to know the facts. ketoacidosis in the hospital, okay? It's just cheaper. It's better to diagnose breast cancer early and do the lumpectomy rather than wait until they get metastatic disease and cost hundreds of thousands of dollars, okay? So we couldn't get our patients into the hospital because all these other people who shouldn't be there were there. So, you know, there was also the issue of portability. People were trapped to their jobs. So one of the things I want to talk to you about is also when you need to educate your patients, you need to educate your colleagues and your parents and your relatives about why this is important, okay? So that means you need to know the facts. You can't just talk kumbaya, all right? I'm big into kumbaya. I believe in compassion and empathy, but facts do it. And I learned that actually from my wife. Some of you, a lot of you from Duke may know my wife. She's Laura Spetke, who's vice chair of medicine at Duke. And when I was going to go testify against Lieutenant Governor Gardner, I was nervous as heck, and I wrote out everything. Normally, I don't write out my speeches, but I wrote out everything, and I gave it to Laura to read. And she read it, and my last thing was, the last two sentences of my talk to this Senate committee was the cost of testing all those people. And Laura said, you know, that's a real powerful argument. Move that to the first. And literally, I said, it's going to cost $1.5 billion to the state budget to test all these people every year. And that was the end. The guy gavelled the hearing and said, what? Forget it. So, you know, be strategic. You got to talk about money and savings and things as well as compassion, okay? So, for instance, with the immigrants, right. The immigrants. People don't understand that the reason we are able to have Medicare and Social Security for baby boomers like me isn't because of the money I put in when I was working. It's because of undocumented immigrants in North Carolina putting in $1.5 billion of taxes. Because their taxes are going to Medicare and to Social Security, only they can't pull anything out because they're undocumented. They're supporting us. So you've got to know those facts. Yes, it's important to have compassion for families and things like that, but also know the economic facts so that the people in the middle understand why we need those immigrants to drive this economy, to take care of our children, to take care of our parents, to mow our lawns, to run our gas stations, and also to pay taxes so that I can retire with Social Security. So, the other thing is there's this huge attack on the government. Everyone says the government's terrible and all of the regulations. Remember what the FDA did. Remember thalidomide. Some of you may not remember the story on that. There was a courageous woman at the FDA. So thalidomide was manufactured by a German manufacturer, and it was approved in Europe for nausea. Was it nausea? Yeah, nausea in pregnant women. And there was no big journal articles about it, but a very smart woman. What was her name? I don't know. She actually got the Medal of Freedom from Clinton, I think, before she passed away. And she was at the FDA, and she kept getting this application. She was at the FDA, and she kept getting this application from this company, and they wanted approval in the United States. And she said, no, no, no. She said, well, we'll give it away for free. And she said, no, no, no. And that's why there was no big thalidomide epidemic of limbless babies born in the United States. So the courage and the importance of our federal institutions to keep us healthy, to keep the air clean, to keep the water clean. You know, I've worked in Africa for 17 years now, in Malawi, South Africa, and Liberia. I know what it means not to have adequate sewage, not to have clean air and clean water. Okay, so all these things. So what did the FDA give us? It gave us portability. It gave us insurance for 20 million people. It gave us preventive care, free preventive care. Our abortion rate in the United States is the lowest ever now, ever. So since antedating Roe v. Wade. And it gave us the portability, which allows people not to be tethered to their jobs, so they can. It's freed up entrepreneurs and artists, etc., to leave their work.
No lifetime coverage limits either.
And no lifetime coverage limits, no pre-existing conditions. And those of us see, I'm a one percenter. From a two-physician household. It's, it's important. As doctors, we have empathy. We should have empathy for our patients and nurses, etc., for our patients. And, it's important to put yourself, as many of you with your anecdotes, to put yourself in the position of your patients and the fear and anxiety they have over being able to have their health care done. And you have the power, they don't, okay? So it's important for us to stand up for our patients. So, what are the things I want you to do? My 10-point plan. So many of you, first of all, were really discouraged after the election, okay? But in North Carolina, we're the model for the rest of the country. We've been through this crap for the last 6 years, okay? And we're still here. And despite Trump winning, and first of all, he did not get a majority in North Carolina. Many of you don't realize it was 49% he got here, not more than 50%.
Gerrymandering.
And despite 50% of the voters in North Carolina voting for Democratic state reps, for Democratic federal congressmen, only 25% were elected because of the gerrymandering.
Yeah.
Okay, but what success did we have? We threw out the first incumbent governor in North Carolina history. Jewish Attorney General. We elected a Democratic auditor. Okay? We elected Democratic judges, including a judge on the Supreme Court, an African American. And we flipped a total of 4 House seats in the North Carolina House Caucus. We're rated the most effective House caucus. And what did we do? Again, it's strategy. You can't just press like on your fucking Facebook page. Please. Okay? You gotta do stuff. So what does the House caucus do? The House caucus looks at races that are within 5% of each other, and we're in polling data, and they put only their money into those. They don't put money into safe Republican seats. They don't put money into safe Democratic seats, okay? And each election, if you email me, I'll tell you who the key candidates are. And there are usually 6 to 8 House reps. We've got to get rid of the supermajority in the next election. And then by 2020, we have to assume the majority in North Carolina, so in the House, we won't get it in the Senate, so that we can stop the gerrymandering after the 2020 census. Yes. So, okay, so anyways, what is my 10-point plan? First, like I said, learn the facts. Read, there's North Carolina Health News by Rose Hoban. She'll tell you all the facts about what's going on. It's a email thing. She's a health reporter. I read the New York Times. I read the News and Observer to know what the heck's going on. It's also good to subscribe to them because they need support. And those of you who aren't students, you can. And if you're a student, you can get a huge discount. And if you're not a student, they need your subscription. The other thing, and most of you are already doing because you told these stories, is pay attention. When you walk into the room, notice the anxious father, mother, child, grandmother in the room, and not just focus on your patient's livers and lungs, okay? What are they anxious about? You can't just write a prescription if they're not going to get it filled, okay? So try to think beyond your immediate concerns of making the correct diagnosis and giving them the prescriptions. The other, and one thing I do to help you with that is I actually write. I write nonfiction because it helps me pay more attention. James Joyce talked about this in Portrait of an Artist with a Young Man, where he's walking back and forth, not noticing to school, and then all of a sudden he notices a church steeple that he'd been walking by for 10 years, but he never noticed it because he wasn't paying attention. So if you write, you'll start paying attention. You know, write a blog, write a journal, etc. The other is find others, and you're doing a good job of that. But I want you to do it better next time. I want to see more UNC residents here, where they reached out to. It's easy to go to the person who's next to you. I want you to reach out and expand. ECU is another medical school. Wake Forest is another medical school. Nursing schools, etc.
Campbell University.
Campbell University, NCCU Nursing School, etc. Reach out to them. There's power in numbers. The reason in North Carolina we have we had 200 physicians and students at the HK on J March on February 11th. It was organized by Perry Morgan, Duke PA faculty, and myself. Okay, and we just reached out to a huge group, and we had over 200 show up. Visit other organizations. Who's the nice link? You. Introduce yourself to this nice woman. What's your name?
Ann Chapman.
Ann Chapman. Meet Ann Chapman. Find out what she does. And say, tell us what your needs are. I, as a physician and nurse or PA or pharmacist, you're taking care of my patients, my clients. What are the issues? Okay. What can I push for? Because you've got the power. Ann does not. You've got the white coat. Unfair as it is, you've got the power and you got to use it. Find common goals, okay? We're not going to solve every problem, all right? The reason we've been successful is there's 200 organizations. We subsume, each individual organization subsumes its personal little agenda to the greater good and lets the NAACP North Carolina coordinate, okay? So I heard once there was a rally 2 years ago that the NAACP-MC was organizing the Moral Monday movement in Durham. And I saw some chatter on Facebook that people were going to also make it a big pro-Palestinian thing and anti-Israeli thing. And so I thought about it and I said, you know, I think that's a bad idea. The Moral Monday movement is not going to solve the Israeli-Palestine conflict, okay? Now, I'm Jewish. I detest Bibi Netanyahu. I think the Israelis need to get out of the West Bank. But I'm not going to solve that problem here, okay? We got a little more immediate problems. Let's not do it. So I texted Reverend Barber and I said, I heard this. Can you please make sure that this doesn't happen because it's going to split your movement? And it didn't happen, okay? 2 weeks ago, the head of the Physicians for a National Health Plan came and to our doctor thing. She was from Tennessee. She drove. I introduced her to a reporter at our breakfast that I held, but I told, while with the reporter here, I made sure she knew the reason we succeed is we keep our eyes on the common goals. I want single payer as much as the rest of you. But at this point, frankly, we're got bigger problems than I want single payer, but that's not the major issue. The major issue is keeping what we have and fixing it, okay? So, and I wanted to make sure that the woman representing the Physicians for National Health Plan understood that we keep our eyes firmly focused on the prize, okay, and not have squabbling over what in reality are minor issues. Be strategic, okay, and that's what I meant is don't just talk about emotions and being kind. Talk about money. A sick patient doesn't pay taxes, okay? You know, when a sick patient fills beds and costs us a lot of money, preventive care saves us money. We know that there's tons of data, okay? We know that because we haven't expanded Medicaid in North Carolina, anywhere from 500 to 2,000 North Carolinians die prematurely. These are taxpayers, okay? We need everyone we can here. Write. I try to write 3 to 4 op-eds a year for the News and Observer, for the Charlotte Observer, for the Greensboro. Avoid it. with early detection and surgical removal. Give money. Those of you who have salaries, give money. North Carolina House Caucus, give to the organizations that are political organizations, they're charitable deductions that register people. Give to the organizations that represent our disenfranchised patients, Latino health, LGBTQ health, substance abuse, all those organizations, they need help. Give money to the lawyers. The other thing I didn't mention, in North Carolina, not only did we win politically, but 8 different separate bills that the legislature passed have been overturned in state and federal court. Okay. And not just because by Democratic judges, by Republican judges, because our legislature, just like the federal Congress is doing, is going to overreach. Okay. So give to the ACLU, give to the Southern Poverty Law Center, give to the NAACP Legal Defense Fund, give to the Latino organization, the environmental thing. Give to all those organizations. Protest. That's it.
Yay.
And yes, sometimes, and it's very targeted, okay, you can get arrested. Now, my thing, it wasn't a random thing, okay? I went, they asked me, was I prepared to be arrested? I thought about it, and I said yes, I would do it. I was assigned a lawyer, we were trained, we went in. So many of you think that a lot of this stuff is all spontaneous. It's not, it's hard work. So Rosa Parks didn't just go there, she planned it. She was trained in civil disobedience, as were a long line of activists going back. Okay, so I went in and I was arrested. And it wasn't they asked me to wear my white coat. I had to remove my lawyer made me remove my stethoscope because they said the Capitol Police would think it was a weapon. Weapon of mass destruction. And I was arrested. And because of the picture that was taken, which wasn't planned, then it ended up on the front page of the newspaper, the News and Observer, and it galvanized a lot of healthcare workers, which I was glad. But then I had to make the decision, was I going to accept a plea or was I going to move forward? And I decided, I thought about it a lot, talked about it with my wife, and because going forward with it was a pain in the neck, really, because I had to go back and forth to the courthouse. And I decided that if it was good for publicity, if it educated people, then it was the right thing to do. And every time I went into the courthouse, I ended up on the front page of the News and Observer. I always wore my white coat in the courthouse, in the jury, on the trial, etc. And it educated people. It did 2 things. It educated the people in the middle that this old, wealthy, powerful physician was willing to do this. Why was he willing to do this? Okay, I wasn't some wild-eyed crazy person. I did it for a reason. I did it for my patients, and they heard that and they listened. Okay, the other thing it did is that for the patients, whenever we had the Moral Monday movement, and we would have 5,000 or 10,000 people on the mall behind the general legislature, when I would walk into the building after that, people would reach out and touch me to thank me as we would go through the corridor. It was a very, very powerful thing. They were grateful, these undocumented folks, poor African Americans, poor whites, they were so grateful that I, in a position of power, was willing to represent, make sure their voices were heard. So I am very, very heartened that all you are here. I feel comfortable now that I can retire. So you guys are going to keep up the fight. But seriously, I'm going to be out there with you. Anytime you want me here with you, just send me an email or a text and I'll be here with you. Remember, hands off the ACA, hands off Medicare, expand Medicaid.
Yeah.